How are we today? Perfect. My name is Dr. Quinn. I will be examining you today. Also getting some of your history down. Looks like a little bit of this paperwork needs to be filled out. And then before we begin, could you verify your date of birth for me, please? All right, thank you. All right, so kind of what we're going to do is, since you've never seen us before, I just want to go through this paperwork with you, get some of your history. There's some consent forms that you need to sign. That way we can just get some of the records from your primary doctor. And you've had blood work recently and everything looked good? Okay. Yeah, the thing about blood work is it's always good to take it again to compare the results. And there's so many things to look for. So I'll get your symptoms, what you're experiencing, why you're here today. And that way we can look for specific things in your blood work. We'll start there and then do other tests, just depending on what issues you're having. All right, sound good? All right, perfect. All right, so you have all this filled out. Okay. Okay. All right, and your email. Okay. All right, address, and were you referred by anybody? Okay. How did you find us? Okay. All right. So no, you are a new patient. No. Right. Okay, yes, this personal guarantor responsible for payment or services. That would just be like if someone was paying for you. Generally, that would be for more of a child, but if you have your own, you're an adult, you have your own health insurance through your employer, you would not have to fill that out. Okay, emergency contact. Okay. All right, and relationship. Okay. Insurance information, we can get that a little later. Let me get some of this out of here. Okay, consent release. All right. So this is the consent to release medical information. Okay, so that would be hereby authorize the practice. So release information to the doctor. Here's our appointment cancellation or no-show policy. I don't think it's a surprising fact to know that we are booked. I know that you had called and it took 2 months to come in and see us, so I appreciate you you know, waiting that time to come and see us. I know there's a lot of other providers that you can go to. Let's see. Okay. Thanks. Okay, so personal information there. Do you have any history of high blood pressure, heart disease, migraine, okay, cancer, lupus, diabetes, blood disorder, headaches, depression, chemotherapy, high cholesterol, stroke, brain tumor, thyroid disease, radiation, multiple sclerosis, Parkinson's. Okay. Do you have any allergies to medications? Okay. Let's see. Okay, I see you have your medication listed. So you do a vitamin. Okay, so D. All right, and okay, magnesium as well. Do you know the dosage? Do you live alone? No. Okay, tobacco use? Alcohol use? Drug use? Special diet? All right. Okay. All right, so this is in regards to family history. And this is going to be like your blood relatives. Okay, so it would be, you know, your parents, your sisters, even your cousins, your aunts, uncles, grandparents, but not those who married into the family. Okay, so if, you know, your aunt is your dad's sister, married, you know, a guy and he's your uncle, don't care about that, you know, because that's not a blood relative. So this is just that there's a family history of any of the following. All right, so high blood pressure. You're wrong, okay. Heart disease, migraine. Okay. Ooh. All right, so there's quite a lot listed here. Let's see. Okay, so that. Okay, seizure, epilepsy, Parkinson's, Alzheimer's, lupus, diabetes, blood disorder, depression, okay, multiple sclerosis, high cholesterol, stroke, thyroid disease. No, okay, all right. Sarcoidosis, all right, yeah. Sarcoidosis is different. That is listed on here, so that would be, all right, so we'll put that as your family member. All right, thyroid disease. All right, so that's that. Okay, so the next one is a review of your symptoms that you're experiencing. Okay, so general fever, chills, sweating, loss of appetite, fatigue, jaw pain, tongue pain, joint pain, muscle pain, limb weakness, numbness, seizures, tremors, vertigo, okay, brief vision loss, falls, headaches, trouble walking, insomnia, snoring, restless leg. Okay, we'll do kind of. All right, so blurred vision, double vision, vision losses, eye pain. Okay, so in terms of ear, nose, and throat, any ringing in the ears, loss of hearing, nosebleeds, okay. Skin, rash, suspicious lesions. Okay. In terms of respiratory, are you having a cough, difficulty breathing? Okay. Frequent urination, urinary hesitancy, incontinence. Okay. Gastrointestinal, any nausea, vomiting, okay. Diarrhea, constipation. So in terms of musculoskeletal, back pain, joint pain, muscle cramps, joint swelling, muscle weakness. All right, okay. Depression, anxiety, memory loss, paranoia, confusion, chest pain, palpitations, cold intolerance or heat intolerance, abnormal bruising, abnormal breathing, recurrent infections. All right. Okay. So all these other forms, they are for you to complete. Just do a markup here. Okay. Anything else that you've been experiencing that you would like to report that I haven't listed? Okay. And when did that start? Is that both sides? Okay, both sides. Does it come and go? Does it switch sides? Okay. Yes. So numbness and tingling, anxiety can cause that. A B12 deficiency can cause that. Those are the, kind of what you hope, which is the cause of those symptoms, but it could be something, more serious. A lot of tests, everyone expects you go to the doctor, you get an answer right away. I mean, maybe if you were rich and famous and you could see me every single day and I could just do test after test, you would get an answer sooner. But a lot of these things, especially like neurological symptoms, it takes a lot of testing. And kind of comparing and seeing, your muscle function, your nerves, your nerve reactions. So it can take, unfortunately, it's a long road to trying to even come up with a diagnosis. So it can be a very frustrating journey. In the meantime, you have these symptoms, you get anxious, and, you go on the internet and you start, searching all these things that it could be, and then you get depressed, and then that adds to these, symptoms you're experiencing. It's a horrible cycle. But you are here, you're taking the first right steps. All right, I'm going to order some blood work. You can take it right out to the counter there. They'll give you a slip and you can go right next door. You are fasting? Okay, so you can go ahead and you can do that. I'm just right outside the door there. All right, and this is yours. All right, thank you so much for coming in. Any questions, please don't hesitate to call. Once we get all that blood work done, we'll go from there, okay? Even if everything does look good, there's many other things that we need to test. So just because your blood work looks good and we cannot find anything from there doesn't mean that there's other tests that, are not going to give us an answer. So we want to try out everything. All right, so take that on out there. You're going to follow me on out. All right.